If you've started noticing your sleep changing in your late 30s or early 40s, you have more awakenings, lighter sleep, or even full nights of restlessness, it's not just stress or bad luck. During perimenopause, your hormones begin to shift. And this happens many years before menopause, often up to 4 to 10 years before the age of 47. And one of the first signs of this is disrupted sleep. So, today I'm going to talk to you about why that happens and how a simple medication like progesterone could help restore your sleep. We see this every day. You have tossing and turning. Some patients have night sweats. They have early awakenings. But it's not just stress, it could be your hormones in transition. As estrogen and progesterone start to fluctuate, your brain's ability to be able to maintain a deep and restorative sleep starts to change. So, we talked about some of the things that patients experience, but typically you have fragmented sleep, lighter sleep, early morning awakenings, like we talked about, and just non restorative sleep and tiredness throughout the day. So here's what's actually happening. Your estrogen levels, which are on top, begin to fluctuate as you go throughout perimenopause. And your progesterone is on this steady decline all throughout the time of perimenopause. So your estrogen is erratic, your progesterone is declining, and your progesterone is the calming hormone that we rely on to help us sleep deeply. When you have an imbalance between those two, you get instability in your mood, in temperature regulation, and especially sleep. So if you're thinking right now, progesterone is a miracle drug, let me tell you how it works. So progesterone actually converts into a metabolite called allopregnanolone, and that acts on the same receptors that are called GABA receptors in your brain that cause a sedating effect. Alcohol actually also affects these receptors, and this is the same pathway that promotes a calm sleep. But as your progesterone declines, your natural calming mechanism weakens. And so, by restoring the levels of progesterone, we're not just balancing your hormones, but we're restoring that sense of calm and deep rest. Add to all of this fluctuating estrogen levels, and this disrupts your body's ability to regulate itself from a temperature perspective and gives you hot flashes and night sweats and why you wake up in the middle of the night. Even 1 or 2 awakenings every night can decrease your sleep efficiency and leave you feeling tired the next day. So, if we can restore balance, that'll help stabilize your temperature regulation and allow your body to maintain deeper sleep cycles. So, how do we know all of this? Well, there was a clinical study completed where perimenopausal women who had night sweats were given 300 milligrams of what we call oral micronized progesterone at bedtime. And what happened is those women experienced better sleep. They had better sleep quality, they had fewer sleep awakenings, and an overall improvement in their well being. It isn't just anecdotal. Progesterone has a real and measurable impact on sleep quality for women in your midlife. So, what should you talk to your healthcare provider about? Well, if you're experiencing disrupted sleep, you need to talk with your healthcare provider. You can ask, is progesterone right for me? What form would be best to help me with my symptoms? And how can we track my progress over time? Because you deserve a personalized approach, not a one size fits all solution. And the truth is, hormones are only one piece of the puzzle because foundational sleep habits have to be present for you to be able to get a good night's rest. And these are always sleeping in a cool, dark room. Try to avoid screens for an hour before bedtime. Limit your caffeine and alcohol intake. But most importantly, be consistent. Go to sleep at the same time, wake up at the same time. And these are all habits that support the hormonal changes that we're all working to stabilize. Because the truth is, sleep isn't a luxury, it's a vital sign and an important biomarker of your health. And when we restore progesterone balance, we're able to restore deep restorative sleep that affects everything from metabolism to mood to memory. It's about helping you feel like yourself again. So let me know, what questions do you have? If this resonates with you, follow along for more conversations about all things living well and feeling well from the inside out.